Blair Best. It's Thursday here on The Story, and tonight we've got a lot to get to. An update on our Uncommitted series looking at mental health care in Oregon. What we learned in court today about whether or not the state will be held in contempt for not moving defendants into the state hospital fast enough. Plus, a KGW investigation looking at medical billing. A Portland family stunned by a bill for over $400 for a walking boot from urgent care when they found the exact same thing online for $50. But first, if you have young children, you know the first few years are grueling. But a bill in Salem is aimed at changing that. The sponsor joins us live in just a few minutes. Plus, a former Oregon governor who we rarely hear from sat down with us to talk about his efforts to help Oregon families. It's our big story tonight. Anyone with kids can tell you the first 2 years can sometimes be the hardest, especially if you don't have a lot of support from family and friends nearby. Well, there's a bill in Salem this session to try and make that time easier for parents by addressing their needs and their child's needs early on. If passed, Senate Bill 1167 will fund early childhood hubs around the state for new parents and their kids to get help with things they need. The idea is to address a family's needs when a baby is young to try and prevent problems later in life. Now, one of the bill's champions will be a familiar face for a lot of Oregonians, former Governor John Kitzhaber.
The factors that create stress on mothers and on families are mostly related to the inability to meet basic needs: food, shelter, clothing, etc. Right? Think about it. If a pregnant mom or a family with very young children wakes up every day with the stress of uncertainty of not knowing where that next meal is going to come from or whether they're going to have a place to sleep, they live in this toxic crucible of stress that undermines everything we know about healthy brain development in children.
That upstream idea to address problems early has medical benefits as well, according to Kitzhaber, who worked as an emergency room doctor before he was governor.
You know, when I was in the ER, I used to see people who would come in for the treatment of medical problems that were the result of social circumstances. And I would treat the medical problem and send them right back into the same environment. And it became really clear to me that the medical system is sort of the back end. We don't spend much on prevention, but we spend huge amounts of money, over $4 trillion a year, on the medical system. So that coupled with this new science called epigenetics, which has demonstrated very clearly that poor nutrition and maternal stress before conception and during pregnancy can alter the genetic expression in the unborn child. And it dramatically increases the risk for poor cognitive functions, learning disabilities, behavioral problems, even substance abuse issues, and the early onset of a whole lot of chronic illnesses.
The bill is being called the Child Success Act, and it focuses on the first 1,000 days of life from about conception through age 2. Those community hubs the bill would fund are all about supporting those children and families in many different ways. One of the organizers of the plan, Chelsea King, explains.
We want to make sure that that family and that child has everything they need to be well. So we're talking about housing and food, access to healthcare, but also things like parent education and like breastfeeding support, substance use disorder supports, and anything that family needs to foster that early relational health that is so important.
There would be 7 hubs around the state. Each of them have already spent a year in a pilot program developing their own child success model, essentially how they plan to address the biggest needs for small kids and their families in each community, since it's not the same across the state. Everything from mental health support for mothers to cash assistance to support for fathers and expanding access to housing and childcare, helping new parents navigate a time that can be overwhelming.
There are a lot of great programs and a lot of really dedicated, intelligent people who are working on this, but the system is so fragmented that sometimes parents just have no idea where to go, or maybe they go to the pediatrician and the pediatrician is an awesome doctor and can identify they have needs, but they get sent out the door maybe with a phone number to call or something, and it takes too much to figure out who to talk to, which paperwork to complete, when to show up, like how to submit the paper, like the whole navigation thing.
Now, the main driver behind the bill being that idea that early investment will pay off later in life and help us avoid some of the problems that we see every day.
A lot of people who are homeless have been abused as children. Children who suffer abuse when they're young are much more likely to be addicts as adults. I mean, it's very much interconnected. So definitely we need a statewide effort, and I would argue a national effort, to address both the addiction crisis and the crisis in houselessness and behavioral health. And if we don't begin to address the root causes of those things, we're never going to get ahead. The back end expenditures are going to get bigger and bigger and bigger to a point that we just can't fix it. So what we're asking the legislature is to give us a very small amount of money out of a multi-billion-dollar budget for 5 or 7 design pilots to basically prove the concept, to show that, if we spend money on the front end here, we're going to have much better outcomes later on. We're going to have better educational outcomes. We're going to have better health outcomes. We're going to reduce the chronic care burden and absence in school. And so let's make that investment now and prove that model, and then let's begin to resource it more intentionally.
They're asking for $12 million from the state general fund to get the hubs up and running for the next 2 years. Each of the hubs will be required to track how that money is used and demonstrate with data how effective it's been. It's part of a bigger package of bills in this session being called the Momnibus bills. All right, joining us now live is Oregon Senator Lisa Reynolds. She's a practicing pediatrician and the chair of the new Senate Committee on Early Childhood and Behavioral Health. She's also one of the chief sponsors on that bill we just told you about. Senator Reynolds, thanks for joining us.
Thank you so much for having me.
So we detailed much of what Senate Bill 1167 would do. Is there anything else you would like to add?
No, not to that bill. I have my whole other package of bills, but thank you so much.
Okay, let's talk about those other package of bills and the Momnibus bills. What other issues do those focus on?
Well, we really are working hand in glove with Governor Kitzhaber and his team. The way I've been thinking about it is they're going deep into a couple communities, or several communities, I should say, to really provide everything a family might need. I would say I'm looking almost a little bit more broad-based on some basic needs for folks. So I have a package of policies that we've coined the Momnibus for 2025, where we look to really surround people with the services that they need for, as Chelsea said in the previous segment, to really foster early relational health. If we can take away the toxic stress of poverty, of homelessness, of substance use disorder, of fear of losing your child to child welfare, then we can really foster that early relational health, that kind of serve and return between parent and baby, and we're just going to see much better outcomes for these kids.
So as a pediatrician and a state senator, tell us, why is this so important to you?
Well, certainly in my practice, let me step back. One of the reasons I decided to run for office is that I wanted to do more for my patients than what I could accomplish in the exam room. And I'm still in the exam room. I'm still seeing patients, although I'm taking a little leave of absence during this session. And then when I came over to the legislature and I saw how often we systematically fail kids, right? Whether it's that people who are seeking substance use disorder during pregnancy and can't get it, and then we end up having a situation where a child might be born with exposure to drugs or have to be placed in foster care. I started seeing the system challenges, or the fact that the demographic at highest risk for eviction is babies. Then I wanted to take what I saw the one-on-one in the exam room with what I'm seeing system-wide and really fix those problems. Like, let's do everything we can to make sure that babies are never evicted. Let's do everything we can to get someone in, a caregiving parent, into mental health services or substance use disorder treatment. Let's mitigate poverty by improving the child tax credit, which we've implemented here in Oregon since 2023. And let's certainly do all we can to support pregnant, birthing, and postpartum mothers through doulas and other traditional health workers.
I'm curious, how optimistic are you that these measures will make it to the governor's desk?
Well, I will tell you, everyone loves Momnibus. Part of it is the cool name, and we also have some cool graphics and buttons. But everyone gets, right? If we just, if we did better by babies, we would see, we would improve our third grade reading levels. We would decrease the number of kids in emergency rooms. We would decrease the number of kids in child welfare. We would decrease the emotional dysregulation we're seeing in some of our kindergartners. So everyone gets it and everyone loves it. The challenge, of course, is the funding mechanism, right? We have so many crises that we are responding to and that we have to respond to. But I keep arguing that we can't keep sending the ambulance to the bottom of the cliff. We have to put a fence at the top, right? By reducing children with behavioral issues, with mental health issues. And we can do that through policies like Momnibus. It tends to be a little bit harder to dedicate spending to preventative measures because the crisis is staring you right in the face, but we have to do both. And as we do more upstream investment, we will see, obviously, less need for the crisis response even in this biennium, if not future bienniums.
All right, well, we will keep following this. Senator Lisa Reynolds, thanks so much for joining us.
Thank you so much for having me.
All right, now it's your turn to weigh in. What are your thoughts on the Momnibus bills? How about Senate Bill 1167? Should the legislature give $12 million for those community hubs? Why or why not? Email us at thestory@kgw.com or call and leave a voicemail, 503-226-5090. Turning now to a KGW investigation into a case of medical billing that will have you wondering if the same has happened to you. A Portland family stunned that a walking boot they were given at urgent care cost more than $400 when the exact same thing sells online for about $50. An example of outrageous medical pricing that they say shows what the healthcare industry thinks it can get away with. Kyla Boshi has the story.
When Jennifer and Brian Alger's son got hurt playing soccer, the Portland couple did what most parents would. They took him to the doctor.
And we went straight from the soccer field to urgent care.
The treatment? Pretty straightforward. The 13-year-old broke his foot and was given a walking boot. But then came the bill from a Eugene company called Synergy Medical Systems. It demanded a payment of $129 for that walking boot. At first, the Algers thought, maybe this invoice was for insurance to pay, not them. So they asked for an itemized bill. It showed insurance had already agreed to pay $300, and their co-insurance, the amount insurance didn't cover, was $129, which meant that walking boot cost a total of $430.
This is a company that's taking advantage of families in their most vulnerable times.
Keep in mind, this is not a particularly complicated device. A quick search shows the exact same walking boot is available online for about $50. Amazon has it for $64.99.
My expectation is that I'm going to be charged a reasonable market rate. I don't expect I'm going to be taken advantage of when I go to the ER or urgent care because something has happened.
The Algers contacted Synergy and asked the company to withdraw the $129 bill. Not because they couldn't pay, but because they felt Synergy had already collected enough from insurance.
Is this the company that you're trying to be? Take advantage of people when they really don't have options or choices?
So far, Synergy isn't budging, claiming these parents signed a waiver at urgent care agreeing to pay whatever insurance didn't cover.
Whenever we go to get our care, we are forced to sign a blank check.
Cynthia Fisher, founder of the nonprofit PatientRightsAdvocate.org, says healthcare is one of the few industries that tells you what things cost after the fact.
As long as hospitals and insurance companies hide their prices, they can charge whatever they want.
When asked to explain, Synergy referred us to its partner company, AMC Billing Services, which wrote in an email, "We built the Medicare standard rate. Then, from there, patient's insurance is the final say on cost of an item. Example, if a patient's insurance says an item is only worth $20, then that is all. That is all that can be collected." In plainer terms, insurers often contract with certain medical supply companies to provide equipment, just as they negotiate rates for other services. The Algers insurance company, Pacific Source, declined to comment. And the urgent care said, for those with health insurance seeking non-emergency care, Patient responsibility or out-of-pocket cost is based on your specific insurance coverage and plan. Which brings us back to this walking boot, which costs 700% more than the online price.
If I were to do it again, I would have declined taking it and just ordered it and had it the next day.
Patient advocates say, when possible, ask about pricing. Find out who's supplying the equipment, if they're in your insurance network, and how much you'll owe out of pocket. If you can wait, pull out your phone and compare prices.
And you can say, I refuse to get it. I'll have it delivered to my door in a couple of hours. I mean, we are empowered to do that, and we can do that.
The Algers feel this $430 walking boot helps illustrate a broken healthcare system where profits come before patients.
A couple other tips to keep in mind if you find yourself in a similar situation. Get an itemized bill so you can see what you and your insurance company are really being charged. And if you want to avoid buying, say, new crutches, ask friends or family if they have crutches at home you can borrow. Check with thrift stores, or there are nonprofits that provide used, durable medical equipment for free to those in need. Kyle Aboshi, KGW News.
Now to an update on our Uncommitted series, where a federal judge is considering holding the state of Oregon in contempt for violating a long-standing court order over and over again. A contempt ruling could force fines against the state and potentially mandate changes to the state's flailing mental health system. Evan Watson joins us now after listening to the arguments in a two-day hearing that wrapped up today. Evan.
Yeah, Blair, that long-standing court order you mentioned says Oregon has to admit mentally ill defendants in jail who are unable to assist with their own legal defense to the state hospital within 7 days. And Oregon has failed repeatedly to comply with that over many years. There aren't enough mental health care beds, and people frequently languish in jail without proper treatment. A judge is now weighing her options: a contempt order, fines, forcing other actions and investment. There are a lot of people and organizations invested in this outcome, from Plaintiff Disability Rights Oregon and Defendant Oregon Health Authority to hospital systems, public defenders, mental health court judges, and district attorneys. Here's one example of the frustration over the state's inadequate mental health system from the Washington, Clackamas, and Marion County DAs. It is apparent that the only way the defendants will live up to their responsibility is for this court to find them in contempt and order without delay significant fines as a clear directive to adequately fund a mental health system with sufficient bed space and staffing at all levels. It's long past time that the blame game offered by the defendants instead of meaningful and attainable results comes to an end. For Disability Rights Oregon, hospital systems, public defenders, and more, the hope is that a contempt order and fines would force Oregon to make serious investments in a case like this, in its mental health care system, boosting capacity across the state, and then also in community restoration options. And there is some precedent here as well. In Washington, a 2018 contempt ruling for failing to provide mental health services to people in jail did spark investments and improvements. The state, Washington, paid about $200 million in fines for noncompliance in a similar case, and the legislature appropriated $90 million to purchase and renovate a previously closed behavioral health hospital. The state purchased that facility, got it up and running, and ultimately helped cut the number of people with mental illness waiting in jail from 500 to 15, meeting compliance standards that had been a problem for a decade. Now, the judge ended today's hearing without a ruling, saying that the issues have been presented clearly and she's taken them all into account and advisement. However, she did acknowledge that Oregon's legislature is currently in session, so there is a timeliness element to this, a clock ticking to enact meaningful and pressing change here.
So what is the plan if lawmakers approve funding, and especially if they don't?
Yeah, that is exactly what the judge asked the Oregon Health Authority, saying, hey, what if the funding doesn't come through? What is your plan there? And they answered that they'll work with that neutral expert in this case to try and ensure some of her recommendations are coming through. They continue on the path that they're doing, but the problem with that is the path that Oregon Health Authority has been taking has not been reaching compliance, and the judge seemed kind of frustrated with that response. So it'll be interesting to see what comes out here in the next couple of weeks, maybe, if she gives an order, and if it is contempt, if it is fine, if it is sanctions or other things, remedial actions to come out of that.
Well, we know you'll keep following this.
Yeah.
Evan Watson, thanks so much.
Thanks, Blair.
When we hear about scams going around, generally we think of senior citizens as targets. But that's not always the case. As Thomas Schultz found out, people looking for love at all ages can also become the next victim.
Across the country, more and more people are turning to dating apps to find connection. Apps scammers use too.
It's turned my life upside down.
Katie Powell was looking for connection on Tinder, and she thought she'd found it when she swiped right and matched with this man. We blurred his face because we couldn't verify his identity.
I mean, it was ongoing, constant texting right away.
Constant texting went on for more than a week.
Made me feel like it was real.
Before he started asking for money.
Instantly, my instinct was like, you've never met me. I've known you 10 days. Why would you be asking me for money?
The scammer told Powell he'd recently run into struggles and had no other family to rely on. He even sent her this picture of him in the hospital. But we found that image is fake. This photo was posted 9 years ago by former MLB pitcher Phil Hughes. The scammer altered Hughes' face.
I was questioning every single thing and knowing like this is not right. But he was able to talk me into the fact that it was right.
The two talked for months. Powell says her scammer had documents that looked real, but were fake. He also paid off her credit card bills and moved $750,000 into her Vanguard retirement account. But eventually, credit card payments bounced. Funds in Vanguard raised red flags and the company froze her account. Eventually, that money added vanished.
I mean, it was physically, psychologically, emotionally just draining.
Powell lost more than $40,000, and experts say scams like this are becoming more common.
The Federal Trade Commission reported that in 2021, consumers lost over $547 million to romance scams.
Julie Campbell is a market director with JP Morgan Chase Bank. She says AI gives scammers an edge, making it easier to change their appearance or voice on a video call, or create fake photos.
They're more rampant than ever before.
Campbell says 1 in 10 profiles on dating apps are fake. Many people never admit to family or friends they're being scammed.
They play on people that, have soft and tender hearts and feel like they're in love.
Like Powell.
Yeah, I loved him.
Forcing the single mom to pick up a second job as she tries to climb out of a cavernous financial hole.
I curse him every time I'm out door dashing, busting my butt to make some more money because of him.
Thomas Schultz, KGW News.
Be careful out there, guys. Well, that is the end of our show. Thanks so much for watching. The good stuff is coming your way next. And don't forget, everyone has a story to tell. Quick note, we will not have a show for you tomorrow night because of Seattle Kraken hockey here on KGW, but I'll be back with you Monday night at 6:30. Have a great weekend.